Officials in the UK have a new warning about the COVID-19 vaccine. If you have significant allergic reactions to vaccines, medicine, or food, you should not get the Pfizer BioNTech vaccine. That warning includes people who carry an adrenaline auto-injector like an EpiPen. Two members of Britain's National Health Service had allergic reactions after getting the vaccine yesterday. Both have a history of allergic reactions and carried adrenaline auto-injectors. They are recovering well. Let's talk more about that. Joining us is NBC10 medical expert Dr. Arnold Baskies. Dr. Baskies, thanks for being with us. So this headline could turn a lot of people off when we already know some people are a little bit hesitant to take this vaccine. It's important to note research shows the vaccine is still a safe option, but give us your take on this.
Well, this isn't surprising. People who are hyperallergenic, people that have significant allergies, can have a reaction to almost anything. And especially people who have a bee sting allergy, for instance. So this isn't at all surprising. There's been so much hype surrounding this one way or the other that it isn't surprising that this seems to be the biggest news article of the day. What really we should be focusing on is the efficacy and the overall safety of these two vaccines. And Moderna is next. So this isn't something that should dissuade people from taking a vaccine. What it should do is raise the issue. Are you hyperallergenic? Do you have allergies that are really significant? Do you need an EpiPen when you go out walking, for instance, in case you're stung by a bee or a wasp? At the end of the day, that's really the group of people that need to be most concerned. Don't forget, this particular vaccine has been tested in close to 100,000 people and has not been shown to have significant type 3 responses that are life-threatening. So people should just calm down a little bit and realize that, yes, you can have an allergic reaction if you are a person that's prone to have those. But for the vast majority of us, that isn't going to be a problem.
So I'm guessing you think that won't have any impact on the FDA Advisory Committee hearing tomorrow?
I would be surprised if it did. The data from I've read through the PDF that was published and that's been made public, and it's very solid data. If every vaccine was effective as this one, we would be a lot healthier people.
We are still focused on the human behavior part of this, and a new survey from the Associated Press shows about a quarter of U.S. adults still aren't sure if they want to get vaccinated. Another quarter say they absolutely won't. What's your message to anyone who's on the fence about this?
Here's your choice. You either get vaccinated or you're going to get the virus. Those are the two choices. And the chances of having a life-threatening reaction to either of the two vaccines so far is almost zero. Nothing is zero, but almost zero. So you have two choices. You can either get the virus and get sick from that, or you can prevent yourself from getting sick altogether with a vaccine. Those are the two choices. So I think people will absorb that and realize that this is a good option.
Dr. Baskies, always a pleasure to talk with you. Thank you so much.
Thank you, and have a nice evening.
Thanks, you too.